The meeting is now live and is being broadcast and recorded.
Thank you, and welcome everybody to this meeting of the Overview and Scrutiny Commission. I've received apologies already from Councillors Ebele, Eggleston and McLean. Are there any more apologies?
No other apologies have been received.
And I understand that Councillor Penfold is substituting for Councillor Eggleston. Please confirm, yes. Councillor Forster has also indicated he will join the meeting late and probably online. Are there? Oh, he's here. Hello, Councillor Forster. Any other apologies? No. No. Agenda item 2, minutes of the previous meeting. If anybody has any comments on the meeting from the 19th of September, please say now. Okay, I move the minutes to be accepted and request a seconder, please.
Adrian Hafji, happy to second.
Thank you, Councillor Hafji. If everyone's happy to agree, the minutes, let's say the minutes have been accepted. Agenda item 3, declarations of interest. Is anybody working under the party whip or want to declare an interest? Councillor Webb.
I'm a patient at Ringmead Surgery.
Councillor Mackenzie Boyle.
Likewise, Madam Chair.
Likewise, Tim.
Thank you. Who's that?
Mike Forster.
Thank you, Councillor Forster. Jenny, do you have a link to Ringmead? Sorry? Do you have a link to Ringmead? Do you need to declare an interest in a link to Ringmead?
Are you a patient then? I am a patient at Ringmead. Yes, sorry, I never thought of that. I am a patient at Ringmead.
Thank you, Councillor Penfold. Oh, Councillor Watts.
I'm also a patient at Ringmead, as is my family.
Okay, thank you. We have noted all of those. Any urgent items of business?
There are no urgent items of business.
Thank you. Public participation. Have we received any requests under the public participation scheme?
I'm not aware of any public requests for participation.
Oh, Councillor Mackenzie Boyle, is that a new hand?
Ancient. Sorry.
Hand. Okay, thank you. Moving on to the substantive part of our agenda. Agenda item number 6, we have Ringmead GP practice joining in person. And I'd like to welcome Dr. Sashdev, Executive Partner at Ringmead Medical Group, and his colleagues to the meeting this evening. Would you like to introduce yourselves?
Yeah, so I'm Anand Sashdev. I'm a GP Executive Partner at Ringmead Medical Group, and you are?
I'm Sarah Bellas. I'm the ICB Chief Nursing Officer and the Accountable Executive for Primary Care.
Thank you very much. Thank you for joining us this evening. The agenda item was requested in light of the recent Care Quality Commission, which might be referred to as the CQC, highlighted some performance issues at Ringmead practice. Dr. Sashdev, could I hand over to you now? I know you have some slides to run through those with an update on the surgery's response, and if we can keep this to 5-10 minutes, please, so that we have time for questions. Thank you.
Sure, no, thank you, and thank you for inviting us to just give you an update on what's going on. So Ringmead Medical Group, next slide, please. What I'm going to do just now is just give you a very brief introduction to Ringmead Medical Group and the challenges we're facing, give you a little bit of a background on the merger, give you a little bit about the CQC findings and the report and the progress to date we've achieved. One of the key issues that is an NHS initiative that we must try and address is access for patients. I'll give you a quick couple of minutes or a couple of slides on that, and happy to take questions after that. So next slide, please. We're a big practice, 150 staff, Ringmead Medical Group. We've got 9 partners plus 14 salaried doctors and 2 long-term locums. We've got lots of nurses and other allied health professionals, with the PCN sort of helping us as well in the whole area with Crownwood and Evergreen. We've actually got a lot of other practitioners like mental health practitioners, physiotherapists and MSK specialists. We've got a huge number of administration team, which includes our business and operational managers, deputy practice manager, IT managers, administrators, receptionists galore actually. and that's 150 staff. Next slide, please. I'm rushing through because I've been told it's a very quick, we're running short of time, so I'm going to go through this very quickly. So the partners, and they're here today with me, include these individuals. A couple of the partners, 3 partners are behind me here, Dr. Singh, Dr. Kran, and Dr. Aloysius. We present, actually, I think, I'd like to think of us as innovative practitioners because almost all of us have some specialism. That's really important to say. So, for example, 2 of the partners are skin specialists and therefore helping patients not be referred to hospital if appropriate to be managed by a primary care specialist. We've got a hematologist within us as well. We've got skin minor surgery specialists and joint injection specialists. There's a cancer lead for the ICB in the team, and actually a Thames Valley Cancer Alliance cancer primary care lead as well within the team. Palliative care specialism is within one of us as well. So we're actually quite a mixed specialist group of GPs, really all in all to benefit the patients. Next slide, please. We do have challenges like all other practices in the whole country. There's a workforce issue. 1 in 5 GPs are under the age of 30 left the profession in 2022. So there's a huge drop in GPs. Retirement rates are very high. Early retirement rates. There's a reduction in sessions such that full-time GPs are now dropping to 3/4 time or half time or even just 2 days a week. And this means that 25% of the full-time workforce has dropped considerably. There's about 30% of newly qualified GPs who've actually left the UK, and 50% of GPs have considered leaving the UK as well. So, and there are less partners. And 60 practices in the UK closed last year. That's in 10 years, 400 GP practices closed their doors. So the morale is really low in primary care, and it isn't good. Next slide, please. And the reason why is because there are increasing demands in general practice in GP land. Workload over the last 3 years has increased greatly, over 36% increase, which is enormous. And with all the workload issues, there is certainly a lot of stress and elements of burnout. I do lots of appraisals on GPs, and over half the GPs complain of stress and actually are thinking of reducing or cutting down in the workload, becoming just locums or salaried partners, salaried doctors. There's not enough time due to staff shortages, expectations of the health services, and therefore the patients is so high now. Much more is being done. The good news is the patients are living longer. But with longevity comes more conditions, more ill health. And what happens is that there's more monitoring required of the number of medications and treatments being given. 10 years ago, if a patient was on 5 medications, that was thought to be, oh my gosh, there are a lot of medication. It's not unusual to see patients on 12 to 20 medications a year to help their chronic conditions. So much more is being done. And of course, with all this stress and extra work, work-life balance and the rewards are not there anymore. So just to give you a very 30-second example, today I've just heard in one of our sites with a patient who came in, tore the plastic screen that the receptionist worked from, smashed it to the floor, threw beer all over the place as well, was abusive and aggressive, and the police had to be called. They arrived an hour later and took him away. But it took an hour to calm him down, to restrain him, and actually some of the staff have been traumatized by it. That is the usual day in general practice at the moment, okay? So I've just heard, and I'm supporting our team, which is really quite a stressful time. Next slide, please. I think what I'll do is very quickly hand you over to Sarah Bellis, who can tell us a little bit about the merger background.
So the Sandhurst practice, as it was prior to the Ringmead Group taking it over, historically it had been a very good practice with a large number of GPs. I think at its height it had 13 partners. Anant's just kind of explained why that model wasn't working, and they gradually lost a lot of their GPs until they were down to 3 GPs to serve a really large population. It's about 20,000, isn't it? 18,000, which is really high. So we were working with the Sandhurst practice to look at the merging with another practice. There was a lot of challenges with that because they wanted through people's wants and needs and things, and actually that merger didn't look like it was ever going to come off. That meant that the ICB had to think about how it was going to support commissioning a new service, and we looked for some interest, and Ringmead were very keen to be supportive. We were very keen on Ringmead being a partner in this because we knew that they had a track record of taking a practice that was in distress, and you'll remember the Crowthorne practice, and turning that around, and they have done an excellent job of something that was really quite a difficult situation. The situation developed, and we ended up, and the situation developed, and during this time, they'd had a CQC report where they went into special measures, the Sandhurst partners, and this is where it deteriorated further, and that's where we needed to make sure that we could help support them have a merger. They brought in a company to support them to improve, and work was done, but it was, I would say, probably not embedded and very surface enough to get through an inspection, and they did manage to get inspected and managed to get the good inspection, but as I say, it was probably enough to get through an inspection rather than deeply embedded. It deteriorated further, and at very short notice we had to make a decision with Ringmead to take over the practice. It was like there were all sorts of issues, including financial insolvency, and so it was something that was very difficult. We were left with the choice of dispersing the list, and that means having no practice in Sandhurst, or proceeding at short notice with the Ringmead group. And Ringmead were amazing and stepped in, and the partners spent many weekends looking into the quality. You can imagine a practice that previously had 13 partners that went down to 3 partners. They were not able to do the work that was required for a population of 19,000 patients to a satisfactory level. And so I think I'm going to hand back to Anand, and he'll tell you what he found when he went in.
Okay, thanks, Sarah. I'll pay you later. So next slide, please. So the merger, we formed Ringmead Medical Practice and Sandhurst Group Practice under a new name, umbrella name called Ringmead Medical Group, with 5 sites. When we actually merged, we thought we could actually work with the north and south locality. Out of our 5 sites, Birchill and Great Hollands would be the north locality, Yorktown and Ellesmere being the south, and Crowthorne could be south, but it could also be north, so that was in the middle. And the advantage of that was that patients could be seen at any one of our locations according to their need and specialist skills. And as I explained earlier on, minor surgery was not conducted at Sandhurst Surgery in the recent years, and so of course they could go to any one of our sites where a minor surgery clinic was being held. Similarly, sexual health, dermatology, joint injection, we do so many different surgeries, and actually when a specialist at any one of our sites, they can actually get appointments there. Next slide, please. So the immediate impact of the merger was that even with the knowledge of a failing practice that Sarah alluded to just now, within a few days we were astounded at what we were going to have to face and manage. There were multiple clinical problems, prescribing issues, administration issues, equipment, HR, building, etc. All became really apparent immediately within a week or 2. There was staff discord within the first 5 months, and in fact we lost half the staff, clinical and non-clinical, within the 5 months. They didn't like being managed, or they didn't find us approachable enough in their words. And the impact actually on Ringmead, the original Ringmead practice, was also considerable, because this is new ways of working, and all of this led to staff pressures with a background of workforce issues as well. There was also a lot of patient discontentment at the merger, which was aimed at us very fiercely in many ways. There were many heated complaints from patients from Ringmead as well as Sandhurst. Zero tolerance having had to be enacted in many cases, and actually this had an impact on staff as well, and stress, and resignations from staff because they couldn't handle it. Next slide, please.
Thank you. I think we've got quite a good understanding already about the really challenging circumstances that you were going into with this. I'm going to ask that the slides are circulated with commissioners so that we can read these in full, but if we can move on to the CQC report and how you're responding to that, because we're at 10 minutes already now, and that's what we need to discuss
so
today.
Therefore, next slide.
Yeah.
So next slide. Okay, so the CQC visit happened in February 2024 and the report was published in July 24. It was a full visit, which should usually be about 3 days, but turned out to be 2 weeks. Multiple clinicians were involved. We had a background of the staff issues, as I explained. We had lost managers. At that time, on the day they visited, we were short of managers. We were short of many staff. Next slide, please. And the amazing thing is that we managed to sort of get a rating of 2 that require improvement and 3 good. So actually, that was actually a pretty pleasing response, given that the visit was 5 or 6 months after the merger, when it actually takes at least 2 years to stabilize such large practices. Any business person will know that. Next slide, please. So the requires improvement I'll focus on. One is safe, and the areas they picked up on was clinical governance, premises safety, medicines and prescriptions management, and processes. Next slide, please. And in terms of well-led, it was the governance issue, roles and responsibilities, oversight of risks, feedback, and shared vision, complaints management, and medical reviews for patients, including diagnosis and prescribing. Next slide, please. So what have we done so far? Well, we've progressed actually a lot in the areas that they'd identified, and I am grateful actually, although it's not fit for purpose in many respects in the media and according to many assessments. We actually thank the CQC for highlighting things which we were planning to sort anyway, but there were a few more, and we're keen to actually progress all those things. So really, we've met with the PPG, we've met with the new local MP recently, we've met with the previous MP before then last year, we've met with a few councillors and many patients. We've shared the progress being made, we've discussed the challenges we're facing, and taken on any ideas that people are sort of suggesting to us to see if they're practically possible to implement. We've written articles in the Sandhurst Residents Association magazine, 4 articles in the last year, to try and explain what we're doing, the new processes in, any changes we're bringing in, just to give some assurance to patients that we are working on it. We've had one of the big areas of anxiety has been repeat prescriptions and medications, which has been a huge issue for Sandhurst. And we met with the local pharmacies. We've had 4 meetings, I think, so far with the pharmacists. One was 2 weeks after the actual merger, to try and align the processes and try and work with them so patients were not inconvenienced in any way. Next slide, please. I can't even read that, it's so far away. So we actually have fairly stable staffing now, having lost half the staff in the past. We've taken on many new doctors, many new nurses, many healthcare assistants, many receptionists. We've taken on new staff. There are business managers and assistants. We've got a quality manager taken on as well recently. So we've taken on quite a lot of people to actually help manage the practice. We've looked at our management structure, what looked like the ideal one when we actually merged in a very short time. We've evolved that, and we're still evolving it. And even recently we were talking about adding more management structure within it so that it became more efficient. We proceeded to get new equipment. When CQC visited, on the day they found that the room that wasn't being used didn't have a couch roll, and we were downgraded for that because of infection control, although the room wasn't being used. Well, we purchased enough rolls and made sure the process were in there. They were talking about sharp spins sitting on the work trolleys. Well, they didn't like that. It needed to be on the wall on a bracket. At that time, we couldn't purchase them, but we recently purchased them again because they came into stock, and now they're on the wall. So some of these things we've highlighted, and we've done a lot more. Next slide, please. And safe and well-led. Well, we've actually put in processes for clinical governance. We've worked up many ways of sharing the learning from any significant events or any learning events. We worked up processes on a regular basis to discuss complaints and any medical alerts that need to be shared from a safety point of view. We've reviewed the complaints process and now actually have more partners actually managing complaints. We had 2 before, we've now got 3 partners managing complaints in the processes. We're sharing complaints with all of the teams on a weekly basis actually at clinical meetings, which we've restarted. We have a quality meeting once a month whereby we share any of the learning, and we make sure people can access this learning through our intra-practice portal called TeamNet. Premises, we've done lots of work to actually make the premises safe, which was in plan anyway. We've looked at emergent drugs and equipment. We've made sure that we carried out fire drills and mock emergencies so people understood what they're supposed to be doing. We do have challenges of staff, and actually getting new staff into place is not always easy. But HR has actually been a really, really positive move for us with our business manager and HR team. And now all the processes for HR in there, including all the mandatory checks that need to be happening pre-employment. We've made sure that training is maximum now. I think the problem with training when CQC visited us was that people had done the training, but they hadn't shared the evidence with us. Now that the evidence is shared with us, we're over 90% trained up to in the essential training. Next slide, please. But we've done lots of other things. We've done medication reviews. We set up processes for reviewing patients. For example, if someone is on a painkiller, when we have a medication review with them, we ask them why they're on the painkiller, how many are they taking, do they know the side effects again and again. So that medication reviews are in place now and all auditable. We audit all of these procedures and processes. Next slide, please. You'll get these slides, so you can have a look at these. But clinically, diabetes was one that CQC identified. There were about 66 patients who should have been diagnosed as diabetic, but hadn't been for a little while. And again, that was historical from previous practice point of view, majority of them. So we've contacted all of them and started the management as should have been. Asthma similarly, inhalers, some people were getting more inhalers, so we've actually worked on that as well. So you'll see quite a lot when you read these slides of what we've actually done. Next slide, please. I just want to share with you the September activity because I thought it'd be worth looking at this. Friends and family test is a feedback from an appointment that a patient's had. 85% rate us as 5-star. Online consultation, which is the new way of working, 90% feel that we are good or excellent. There are lots of NHS reviews, 4 or 5-star. We've delivered a total of, in September, 13,500 appointments rather, and half of them were around face-to-face, and almost equal around all 5 sites. We've received about 15,000 phone calls in September, and we've had over 5,500 submissions for clinic. I'll stop there because I think you're looking nervous about time.
Thank you very much. That's great, and that's a real full. I think we've got a good understanding, both as I said, the circumstances that you were operating under, and what you have done so far to remedy some of the issues addressed. I'm sure my fellow commissioners will have questions to ask you based on that. So I will open up the floor for questions. Can we please keep them brief and keep them as questions? We can move to debate and recommendations after this. Councillor Forster.
Dr. Sachdev, we had a meeting on the 9th of August with ICB Frimley and our MP, Peter Swallow, following the CQC report. And while the actions from that meeting have not been agreed, and indeed my view on what was agreed is different from yours, I have since offered you a meeting to discuss residents' concerns. I've had significant feedback from many residents about their concerns regarding your medical group, and I'd like to discuss them with you with the aim ultimately to having a public meeting. Are you in a position to agree dates of the initial meeting with me at this point?
Yes, I'll be emailing you some dates and times. Most of our practitioners in the GPs in the surgery work from 7:30 till 8:30 every day. So when we actually come around to looking at the protected time available, definitely within a few days, I'll be sending you a link to actually see whether we can meet up at a certain time. Obviously, we want to, and on the 9th of August, we met with you. We've met with Peter Swallow since then as well. And so we will meet with you, of course, and very happy to answer the questions.
Thank you very much. Councillor Mackenzie Boyle.
Thank you, Chair. Nice to see you, Dr. Sachdev. Can I say, all the new doctors that you're bringing on and the new nurses, what are you going to be looking at to ensure that there are house calls, please, for incapacitated patients? I must now fetter my description because I'm also a member of PPG.
That's a very good question. Thank you very much, Tina. We never refuse a house call. We actually proactively find patients who need house calls and reviews. So we are actually doing the house calls. I think one of the slides actually details to you how many house calls we've done this week or in this month, and we will absolutely do house calls. That's part of a GP's role, actually, is to visit the patients, and quite clearly housebound patients have multiple needs which we want to make sure are addressed in as good a way as possible, because the name of the game is quality of life, right? And we want to make sure we're delivering this as best as we can.
Thank you for that.
Councillor Webb?
Dr. Sachdev, to ensure the practice continues to improve, how many staff do you have working on workflow? And what is the ratio of staff to patients on this? And I have another question, but if you want to answer that one first. Did you hear me? I wasn't sure because I was not close to the mic.
Absolutely. No, that's not a problem.
Yeah.
So we have at least 7 workflow staff. Do you know what workflow means?
Yes. Yeah, I think so.
So what is your understanding of workflow, may I ask?
It's really about how much work's going through at the time, isn't it? Sort of.
With
yes.
respect, no, it's not.
No, okay.
No, it's
Fair
not.
enough. Oh,
So I'd be interested to know why this question was raised, because it's an internal organisational issue.
right.
Workflow usually means letters and correspondence coming into the practice,
Right.
and
Yeah.
how is it processed. And
Right.
so we do have many processes in the practice that is dealt with by many receptionists, administrators.
Yeah.
And at the moment, we have 7.
Yeah.
But actually it could vary, it could go up to higher, depending on we get about 200 letters a day, every day coming in, which are letters, correspondence, etc., right? And
Yeah.
that's aside from the results that come in, right? These are blood test results and X-ray results. We get 200 a day on average coming in.
Yeah.
So when it's 300 a day and we see that there's a backup, then the number flexes from 7 to 8 or 10, right? So we move staff around, multitask, actually. So I'm not sure. This is an internal organisational issue, so I'm not sure what the question is aiming for here.
Or to be fair, it's a question that was posed by Councillor Eggleston, and I believe that she works within another practice, so
All right.
it's probably for reference for her. So really, in fairness, I'm really just reading for her.
Okay.
So apologies for that.
No, that's fine.
Okay. Under the news section, could you please publish monthly data on phone calls in and out, appointments made with GPs and nursing staff, documents in, and appointments lost due to no-shows? That's another question from Councillor Eggleston.
Yeah, that's a very good question, actually, and I think
Yeah.
that's something that we're working on. So we do share some of this information with the PPG when we meet with them. We give them a breakdown of what the workload has been like. We're looking at publishing it on our website on a regular basis, but all of this, unfortunately, takes work resource, unfortunately.
Yeah.
Today, we had 5, 6 members of staff gone off sick today. And you know, some of the staff are dealing with all these things. So, you know, if they can't do the job and they're off sick, then we're delayed in publishing this. So we've got to prioritize what is important. But we would very happily, in fact, our wish is, because we would like the public to see what the non-attendance rates are, so they understand what the size of the problem is and how it would actually benefit people.
So, and I welcome that question, because actually I was looking at data for our system today in relation to DNAs, and we've got the highest DNA rate in the whole of the South East region for primary care, which is such a waste of appointments, isn't it? So I really welcome that question. And if there are thoughts that you can think of to help support us to reduce that DNA rate, we would really welcome that.
Thank you very much.
Yeah, and supporting that, just out of interest for Ringmead Medical Group, when we last presented to the PPG, we were one of the lowest DNA rates. Ringmead Medical Group had the lowest DNA rates, less than 2%. But anyway, that's nice.
Be good to get rid of all of them.
Yes.
Thank you. Councillor Watts.
Hiya, Dr. Sachdev. I just wanted to say I've been looked after at both Bracknell and Crowthorne sites for 15 years with my children, and you've always done right by us, so thank you very much. And I'm sorry to hear that things have been so hard. I hope they improve. I do have one question about repeat prescriptions, because I mean, I myself have had a lot of trouble with my son's ADHD medication, for instance. So I know that you've got lots more staff to manage that, and I hope that helps. But how are you going to track that? Is it going to be patient feedback, or how are you marking it, basically?
Absolutely, we do value patient feedback, and we welcome that. What we like, we're a learning organisation, right? And look, we can't solve everything immediately all the time. So I think we would like to hear from patients. We would like to understand where the issues are and help with that. We've had many instances where things haven't worked out. We've reviewed the processes and made some changes, which has actually taken it away, right? So, and we're working with the pharmacist. Currently, as you know, in the last couple of years, there have been stock shortage issues, especially ADHD medication. HRT is another one. The weight-reducing injections is another one. All those stock issues are big issues, actually, and has an impact on us. Now, we're working up processes. We have worked up processes, actually, of making prescriptions automatic on those we can. There are some conditions like control drugs and maybe ADHD medication which can't automatically be dispensed by the pharmacist. So there are some which you'll have to ask for the practice to dispense for you, as long as they're on repeat. If they're not on repeat and a one-off issue, we'll have to discuss it clinically with the doctor so that we can make sure that the right medication, the right dose is being given, because a lot of this medication changes the doses, doesn't it, with the support of the specialists. And in fact, a lot of the specialists are the one who are changing the doses that we don't hear about, and so therefore that causes more complexities. But thank you for your comments.
Councillor Allen, then Councillor Penfold.
Just continuing on the prescriptions, around 6 months or 8 months ago, we were told basically it was a 2-week turnaround to get a prescription out the door. Has that come down over the last few months? And what sort of timescales are you now looking at?
Thanks for that question, and in fact one of my slides will give you that answer. The answer is really that we've invested significantly in staff. We've now got stable staff delivering and processing prescriptions. The turnaround time, you're absolutely right, about 6-8 months ago was 10 days to 2 weeks. It's now down to 3 to 5 days.
Right. Okay. Right. I'm just wondering about clinic. Why does it stop at 2 or 3 o'clock in the afternoon? Because I know several people have got very frustrated because they couldn't actually fill in the form and maybe leave it till the morning till it was answered.
Yeah, very good question again, and part of this will be answered in my presentation, and you can have a look at the slides. That'll be quite useful for you, but that's a very good question. So we found that when we first started employing Clinic as the online consultation tool, and I would remind everyone that if you don't want to do the online tool, you can actually phone the practice and the receptionist will complete it for you as if you're calling up saying, I need an appointment, because that's what Clinic is. It's really to write down what the request is. The benefit of Clinic is that it goes straight into the GP, who then assesses it. And today, I just checked this morning, the turnaround time, incredibly, for one Clinic form to come to my desk as a GP, 6 minutes later completed. So the response was within 6 minutes, all right? So that's the first turnaround time, and you'll see the slide explaining that to you. But in terms of closing Clinic early, when we first started Clinic some 2 years ago, we found that when we had Clinic running till 5:30, the doctors were still calling patients at 10:30 at night. That was the volume of work that was coming through. Huge, and it's unreasonable and unsafe. So we thought, actually, let's reduce it down to finish early, because we found from the statistics, you'll see the statistics on the chart, that actually the call volume is very high at the beginning, first 2 or 3 hours of the day, and then slowly, gradually reduces down to about 4 o'clock. Don't forget, if people still want advice or a service from the practice, they call the practice and the receptionist fills in the Clinic form. They don't refuse, they don't do anything, so it's as if you're completing the Clinic form anyway. So it's a form of triage to try and make sure that the right patients are prioritized in the right way. So it is managing the workload, and it is the new model of general practice. This is the way the government wants us to work, which is to triage the patients, make sure we're managing demand appropriately.
Thank you very much. I think we have taken a good range of questions. So we can move to debate. Would anybody like to speak or make a recommendation? No, I can't see any contributions. Councillor Mackenzie Boyle.
As I am not physically there, I would like to make some recommendation that we do understand and we take on board what Dr. Sachdev and his practice are doing. They did go through a slump, but again, I must fetter my discretion because with my affected interest and also because I'm a member of the PPG. So I think they've done very, very good stuff over the last few years now. Taking on Sandhurst was a heck of a risk, but it's managing coming through. We're having a PPG meeting, I think, on the 21st of October, where we can iron out further issues that Dr. Sachdev may have. So I think the recommendation in the report, Madam Chair, would you like to read your recommendation?
My recommendation.
Yeah. Do you have a recommendation as chair?
No, I thought you were giving yours.
Okay,
Yes.
That's fine. I didn't want to tread on your toes there. Okay. No, I think that we take what we have here, that Dr. Sachdev and his team are working hard towards getting the practice to a degree of sustainability. And we accept that.
Yeah, and we take that comment. I'm not sure that it's quite shaped into a recommendation as such, but we certainly hear your comment, and
Yep.
it's valid.
Okay, can I just add, throughout my cancer treatment and my family's treatment, Dr. Cran and Dr. Sachdev have been nothing but towers of strength. So that's my personal view as well. Fantastic.
Thank you for that. Thank you. Councillor Forster.
So my recommendation would be that we, Dr. Sachdev and his team, explore the options beyond the PPG of public engagements, and I mean by this potentially public meetings attended by the necessary council officers, cabinet members and MP, in order to give confidence to the residents and users of his service in Sandhurst in particular, and Crowthorne, potentially Owlsmore and College Town as well.
Thank you, Councillor Forster, for that recommendation. As you're not in the room, another commissioner in the room will need to move that recommendation. Would somebody volunteer to do that, please? Councillor Watts. And a seconder. Councillor Haffajee, thank you. Do you want to speak to Councillor Forster's recommendation, Councillor Watts or Councillor Haffajee?
Yes, thank you. It's a good idea, and I think that anything we can do to support Ringmead would be beneficial to both them and our residents. Thank you.
Councillor Haffajee.
No further comment.
Thank you. So, shall we vote as a commission to pass that recommendation? And if you could read that out, that would be great. Yes.
So I think it was to make sure that the doctors and the team explore options beyond the PPG and take on board public opinions to take things forward.
Should we take a vote on that? I support that recommendation. Okay. Thank you, that's carried. Any further recommendations? No, and we are running quite over time, so I think we will thank Dr. Sachdev for his very thorough and full presentation, open and transparent description of the situation they are operating in and wish them all the best for the journey ahead and look forward to hearing developments. Thank you very much. Okay. Agenda item 7, the Local Government and Social Care Ombudsman Annual Letter. So we are going to welcome the Council's Head of Complaints, Jen Lawson, virtually to the meeting. Jen, please can you provide a brief overview of the LGSCO letter?
Yes, thank you, Chair. All of the details are in the report that accompanies the letter, but I just want to provide some context to what's in both the report and the annual letter. So the letter provides details of the LGSCO final decisions that were published in financial year 23-24. Because they've been through the council's full complaints process and through the LGSCO's process, that introduces a difference from when they were first raised with us as issues and when the LGSCO has provided their final decision. So to illustrate, of the 12 upheld complaints that the annual letter refers to, the earliest was raised with us as a stage 1 complaint in May 2021 and the latest in April 2023, with the bulk of those complaints having been raised with us as issues in financial year 22-23. The LGSCO investigated 13 of the complaints that were raised with them, and that is comparable to our similar organisations. So we're in line with those. The uphold rate of those complaints, 13 investigated, 12 were upheld, which gives an uphold rate of 92%. That is above our similar organisations of 79% and above the national average of 80%. I would also, for context, point out that there were 13 investigations, so one upheld complaint provides 8%. So that difference between the national average and our average equates to 1.5 complaints. And just to finalise, the annual letter also mentions the Ombudsman's new complaint handling code, which was introduced in February of this year, and councils are encouraged to adopt the code without undue delay. I can let the Commission know that we introduced a revised corporate complaints process at the end of September, which fully reflects the Ombudsman's code and the good practice that's in there. Those are my comments really to go with the report and the letter, and I'm happy to take any questions.
Thank you very much. Jen, do we have any questions? Councillor Allen.
So in her introduction, Jen, you were saying about some of these complaints were going back to 2021, but they're all dated 2023, 2024. Sorry, is that by the time the complaint has been sorted? So that's the end date of the complaint. It was in the last financial year.
Yes, it was decided upon, and the LGSCO, so the Ombudsman, released their decision on that complaint in financial year 23-24.
Thank you.
Any other questions? Any questions online? Oh, Victoria. Hello.
Yes. Yeah, can I ask about satisfaction and how it is measured in the council? Because this obviously tells you one little bit of satisfaction. What other metrics are used within the council to measure satisfaction?
So the council also looks at our overall complaints performance on a quarterly basis. So in the CPOR, it reports on the volume of complaints, and the outcome of complaints, and provides a summary of themes, learning points, and actions that are being taken as a result of those complaints.
Councillor Watts.
Hiya. Do we have any patterns emerging in the complaints?
So in terms of this really focuses on the LGSCO annual letter, where the pattern for us, the pattern follows the national picture of education complaints and SEND complaints forming a large proportion of what we've seen from the LGSCO. In fact, it was high for us, or higher than the national average for Bracknell in terms of the proportion of those complaints that were from SEND.
Thank you. Do we have any kind of feedback from those parents that didn't escalate the complaint any further than level 1?
Again, this process is reporting on the data as it's fed through to the LGSCO, and we report on the data as we see it in terms of when things have been escalated. So it doesn't necessarily provide individual feedback on individuals' experience of complaints.
Okay, are we looking to do that in the future at some point?
That is, as I say, we've introduced a new complaint system just at the end of September, so that would certainly set the scene for looking at how do we understand how effectively that new process is working.
Thank you very much.
Any other questions? Does anybody wish to speak? Councillor Watts, you speak to this, make a recommendation.
Oh, no.
Yeah. Do you have another question? Or?
No, it was just a comment.
Okay, well, as we don't have any recommendations, I think we can thank Jen for attending and let you go, Jen. Thank you.
Thank you.
Agenda item 8, we are welcoming, he's just sitting down, the Cabinet Member for Economic and Regeneration, Councillor Paul Bidwell. I know you've also shared some slides. If I can ask you to keep your overview to 5 minutes, that'd be great. And then we have time for questions. Thank you very much.
Well, thank you, Chair. I think in the trying to keep it brief, there is a video in the slide. We can skip past that if you've seen that. I just thought there might be a little bit of background that you'd want to share. I'd want to share about how we got to where the economic strategy has been published. So, if you just go to the first slide, please.
Thank you.
These are the areas of focus that I'm going to briefly summarise. The economic strategy itself. The presentation, the video that follows this tells a story about what we were expecting from the consultation. The consultation has happened and the economic strategy has now been agreed by full council and we're enacting it. Talk a bit about the Business Improvement District, which is the bid, and then I won't go through all of these, but I'll take each one of those in turn. So if you want to, for brevity, go through the video and we'll go straight into the economic strategy. Next slide. Next slide. Next slide. Okay. So the economic strategy, it focuses on a number of themes. The 4 are there, which you can see. I'm not going to go through those, but what I can say is that there has been some key milestones within the delivery of the economic strategy. The first one was in September with the creation of the Skills Hub, which I'll mention a little bit later. And only this week, we had the inaugural Bracknell Forest Partnership, which was an evolution and a rebranding of the Skills Partnership that was in place before. However, it's important to recognise that the Bracknell Forest Economic Partnership has economic in the title, which means that we will be creating a partnership with business leaders as well as skills advocates to be able to drive the economy forward for Bracknell. Having said that, as the economic strategy develops, we want to also be able to monitor success. So we've also started to monitor some of the key indicators. You'll see at the bottom of the screen that there is a link to the Bracknell website, the Bracknell Forest website, which will give you some more data on how we're achieving that. And then that leads into the Berkshire Economic Strategy, which we'll mention briefly under the Berkshire Prosperity Board. That's being developed by that group. I'll mention that a bit later. So next slide. A key part of what I aim to do and have been doing for the last year or so is meeting as many businesses as possible. There's a flavour of the types of businesses that I've been meeting. My goal is to meet at least one business a week. Unfortunately, the general election interrupted that. My absolute goal is to meet every business in the borough if I can. And when we talk about the borough, we're not just talking about Bracknell Town, we're talking about Sandhurst and also Crowthorne, which is a bit of a jewel which we need to exploit even more. Next slide. I'm not sure why we want to include that as support. I suppose there's an analogy there. Riding a bike is supporting business in the area, but I can tell you I didn't feel very safe on it. But we have been trying to support many different areas. So on the right, you'll see Steve Billy from the Berkshire Growth Hub. I've visited Crowthorne and spoken to their NAG group on a Tuesday about their business issues and an economic strategy. The picture on there is the Growth Hub actually delivering services into Crowthorne. And for those of you who don't know, the Growth Hub is all about new businesses, how they can start, existing businesses, how they can progress, and general information across Berkshire about how businesses can be successful. Next slide, please. The Bracknell bid, as we refer to it, is located in two investment districts, Southern and Western. It's a fantastic exercise in businesses working together to be able to provide projects that can be for the benefit of all businesses within that area. This is financed by a levy, which is being collected by the local authority. And although there was a slow start because of COVID, you're now seeing benefits of those projects visibly, signage, clear pathways, planted out boxes, and most impressive of all is a shuttle bus that runs between the station and the industrial areas, the investment areas, which is being very heavily used, and we will be monitoring the increase of that as the winter months come. But more important than anything else is that the bid is coming to the end of its current period and has just gone out for reballot so that we can go on for hopefully another 5 years. Next slide, please. And of course, although the bid is in the investment districts, part of my portfolio, of course, is to do everything I can to continue the regeneration of the town centre. Now, we have the lexicon, but as you can see here, there are 3 areas that are the next phase of the regeneration. And this week, the SPD was passed by full council, so we will now be going into the full development planning cycle. It will take some time, but we're very, very excited. That is another opportunity to add much needed housing, community spaces, commercial spaces, and a mix of entertainment areas for all in Bracknell. So we're looking very forward to that. Next slide, please. I mentioned it briefly earlier, the Berkshire Prosperity Board. This is the 6 local authorities that have banded together to be able to provide economies of scale. Bracknell is a unitary authority, but quite small. Funding has been difficult. I'll mention that on the next slide. But what we're hoping with the Prosperity Board is that the economies of scale will allow the 6 groups to be able to leverage fundage from either central government or other funding streams. And we're hoping that we expect that our economic strategy will dovetail nicely into the Berkshire economic strategy, which is just about to start. Clearly, and people have heard me say it before, my aim is that Bracknell, it will become the gateway to Berkshire, and people will look to Bracknell as being a leading light on how economic strategy is delivered across the rest of Berkshire. Next slide, please. The UK Prosperity Fund, this is what is known as the Levelling Up Fund. Unfortunately, rightly or wrongly, Bracknell is considered not to be a very needy unitary for receiving funding, but we have had funding, £1 million roughly, that we have put into various projects, as you can see there on the screen. We're coming to the last year is next year of where that funding is spent. projects have come through, and we're hoping that the benefits of some of those things that we've implemented will demonstrate good value for the residents of Bracknell, especially the town centre ambassadors. Next slide, please. This is a very complicated or complex looking and busy slide. This really refers to the work that the UK Prosperity Fund started and has now been taken over by the Skills Hub. And what we're doing there, the Skills Hub, is about bringing businesses, educators together, and so that individuals can freely go into the Skills Hub, which is a permanent location in the Open Learning Centre in East Hampstead. And if they're looking for a new career, they can match their needs with the business needs. And over time, we can look to see whether the educators of the area are developing the right sort of skills, which we know they're not at the moment, that we can then use, the businesses around the Bracknell area can then develop. And I have to say that the Skills Hub has only been in place since September, and we've already had 2 successes where businesses have identified need, and people looking for careers have fulfilled those. So that's really good start, and we're hoping for great things there. Next slide. Last but not least is the property portfolio. As you can see there, it covers 3 types of area. All need management. Some of them are providing us with challenges over the coming year, but also some of them may be providing some opportunity for much needed revenue. It's a very, very important portfolio, and there are plans to make the reporting of what we have and how we use that a little bit more easier to understand and reportable to the wider council early in the new year. Next slide. The Cambion Partnership, this is a JV, as it says on the screen. You've read the slides. We've already delivered Cooper's Hill, which had 28% affordable housing, which is fantastic. Market Street, which you can see is approaching Golden Brick, where we can officially celebrate that the building is underway and on track, and that will deliver 48% affordable homes. And the last one, which we're waiting to get not tenants, but developers in line for, is the depot, where we're hoping that will be 100% affordable homes. The JV has those 3 developments in its portfolio at the moment. It may or may not be considered a partner for the Southern Gateway development, but that is a long way downstream, and we have to really consider the type of development that we are hoping and whether the JV in its current state will deliver that. But overall, the JV is operating very, very well, delivering some income for much needed services or reinvestment into other developments. Last slide, I think, and that's it, isn't it? Thank you very much. Any questions now, please?
Thank you very much, Councillor Bidwell, and welcome, Councillor Barnard, I can see online.
Apologies for late in joining, but my
don't worry,
my
don't
laptop
worry,
just
fine.
wouldn't let me get in.
Don't worry. Councillor Allen, and then I will go online.
I think it's actually just a slight correction, because we're online and it's recorded. You said that the Bracknell Town Centre Master Plan had been approved by full council. It was actually the Cabinet.
Sorry,
not full council.
Yes,
Thank you.
We'll be going through for full council, yes.
Yeah, cheers.
Thank you for clarifying that.
Thank you.
Councillor Mackenzie Boyle.
Thank you, Chair. Thank you, Paul, as usual, for your presentation. And I'm always pleased, and I'm going to read it. Thank you for calling Crowthorne a jewel. It is. It's the jewel in Bracknell's crown. Let's talk about the businesses. We need to sustain them, and need to sustain them profitably. And by doing that, we need a bank. Now, I know we have asked you about 6 weeks ago, what were you going to do to ensure that we do have a bank? And I think there were 300 odd that were going to be up for grabs via the government. Am I right? If there is, can we have one, please?
Certainly, I took that request back. One of the options, of course, was to unblock the creation of a post office in the High Street, which has been blocked up to now. We're trying to appeal that and see what the reasons were and have a sensible conversation. If there's a post office in the High Street, then of course you have banking in the High Street as well. But we will also look at the being maybe one of the 300. So thank you for that.
That would be great. And when can you give us an update on that? You're always very, very welcome just to drop in, as you well know.
Okay, well, possibly the next NAG. How about that?
Fantastic. You've got 5 months.
Okay, thank you.
Thanks.
Thank you. Any other questions? Councillor Watts.
Hi, as you may know, our panel is looking at apprenticeships and school leavers in the area. Do you have any suggestions on that, about how to increase productivity on school leavers within the Bracknell area?
Yeah, I mean, that's really what the Skills Hub is all about. And one of the two positions that were moving forward very quickly, one of them as well, an apprenticeship. The problem with Bracknell is that the NQView level 4s aren't as high as our comparator neighbourhood local authorities. So we need to understand why that is. And we're working with Bracknell and Woking College to see if we can identify the root cause of that. One of the partners is on the Berkshire, the Bracknell Forest Economic Partnership comes from Activate Learning, and so has got a very keen interest in making sure that the pull through end to end of people leaving school have the right careers and stay in Bracknell. One of the problems we have in Bracknell is we have people that are fairly well educated, they go away to university but they don't come back. So that's something we want to try and understand.
Thank you very much.
Councillor Haffordge.
Okay, thanks. I'm going to take you to a specific project, the London Road Strongs Heath. I know there's stuff going on with the actual what's going to happen to the site and what we're going to put on it. That's for another day. It's shared land with the other councils between us. I'm just wondering what you see is likely to happen in that situation and how we're going to work with those other councils, and what you think the options are for that.
Well, at the moment, where we are is that some of the pricing we were talking about the solar farm. Some of the pricing for that is unclear, so we're waiting for Southern Electricity to be able to come back and clarify that. The difference is quite significant. I think one of the prices we had was just for a connection locally, not for provision of electricity or connection to the grid generally, and there's a massive difference in price there. We need to look at that. Once we've got the facts and the figures, and a report is due to be presented to Cabinet, probably in the next 4 or 5 weeks. Once that's done, then we can then decide how we approach the other authorities and share or not the costs of any revenue or not, or the cost of maintaining. As you know, it's an ex-refuge site, so that there needs to be consideration about how that's managed too.
Okay, you haven't had any sort of discussions with the other authorities yet as to what that could look like? Okay, thanks.
Thank you. Any other questions?
Councillor Pickering, yeah.
Councillor Barnard, yes.
Yeah, thank you. Paul, so can I be clear with the answer to that last question, that the decision to proceed with the solar farm, is that an economic decision or a climate-related decision? Because you can make a very straightforward economic case, but my understanding for that project all along was because by using a piece of land that couldn't be used for something else, we could demonstrate our commitment. So I'd really be interested to know what criteria the Cabinet will consider when deciding whether it's something they wish to go ahead with, because there is a big difference between an economic argument and an argument based on reducing carbon emissions.
Couldn't agree more. There will certainly be a lot of interest in the carbon emission side of it, but obviously it has to be backed up by an economic argument as well. If one outweighs the other, that's a political decision, and that will come through the fullness of time once we've been able to look at the report and see what the options are.
That was what I would call a very good Sir Humphrey answer. But the serious point, Paul, is I think I would like to see a report produced that frames this decision in the light of the Council's climate strategy and why it will either be embraced or not.
There will certainly be a report.
Shall we include that as part of the as a recommendation?
Yep.
Do you know what, Councillor Pickering? That's a very good idea. Thank you.
And thank you for the Sir Humphrey analogy. I'm not sure whether that's. I think that's probably a compliment.
Right, let's hold that.
Well, no, it was good. Yeah.
If there aren't any other further questions, we will move on to debates and recommendations, and Councillor Barnard can make that point, and we can move it and second it as per usual process. So would anybody like to speak? Councillor Barnard.
Yes, I was a bit confused by the previous. So I'm proposing that the report be framed in the context of the Council's climate strategy, and therefore that it's clear how it meshes together. I'm happy to take guidance on how I put the words forward, but it's basically so there's clarity and transparency over the decision-making process. That's really what I was getting to. If that's seconded, Mariam.
Yeah, I'm happy to move that for you, Councillor Barnard. Is there a second?
I can't move online. Thank you.
Councillor Allen seconds that. Would you like to speak?
No, I think enough has been said on it. So.
Yeah, I agree.
Thank you. Okay, well, should we take a vote on that recommendation? I think that's unanimously agreed. Thank you. Would anybody else like to contribute anything, speak or make a recommendation? No, well, thank you, Councillor Bidwell, for attending and for that very thorough overview of your portfolio. Thank you for your time, and you can leave us now. Yes,
thank you.
Thank you. So we are going to move straight on to agenda item 9, the transition review scope. I'm going to invite Councillor Watts to introduce the transition scope. We will then ask any questions of accuracy. Councillor Watts.
Thank you. So our scope is to understand what is available to all school leavers post-16, to also include the most valuable and children requiring SEND support in the borough to help them make good and informed career choices. We focus on types of support and guidance available, for example, practical skills such as job and interview skills, improving your CV, that sort of thing. Understanding how support for school leavers is promoted through the borough. Find out what percentage of school leavers utilise the services provided, and identify what gaps, if any, there are in the provision for post-16, and also what influences the decisions of young people, especially those most vulnerable when in regard to making good informed choices post-16. Thank you.
Thank you. Does anybody have any questions for Councillor Watts? Questions of accuracy? No, so I think we can move to debate. Would anybody like to speak? Councillor Watts, would you like to move recommendation in 2.1 of the report, which I will read? Oh, Councillor Barnard, sorry, I didn't see you on my.
Yeah, no, it was just to support everything that Councillor Watts has said. I think it's a very good piece of work, and I think what came out of the scoping session was very much actually looking at the lived experience of the young person going through that transition. So not just what the provision was like, but how you access it and how it felt to be able to access it, to see if there were any barriers that we need to work on. But I'm very happy with it. It was a good piece of work.
Thank you. Thank you. Sorry. Councillor Watts, I will read out the recommendation in 2.1 of the report, and then you can move it. The recommendation is that the Overview and Scrutiny Commission considers the Education, Skills and Growth Overview and Scrutiny Panel's draft scope attached as Appendix A. Would you like to move that recommendation?
Yes, please, Chair.
Thank you. And do you have a seconder? Councillor Penfold. Would you like to speak any further?
No, I think I've said everything. Thank you.
Okay. So we can now vote on this recommendation 2.1. Do we all vote in support of that? Yes. Thank you. So that's carried. Agenda item 10, the work programme updates. Now, we don't have Councillor Eggleston here, but we do have Councillor Watts again. Is there anything more in terms of the Education Skills Growth ONS panel that you would like to update on?
Not at this time, just that I will be presenting on the 27th of February.
Oh, there is a slide here. Yes.
I have a slide.
Yes. Thank you.
Yes, thank you. So we have met with Councillor Bailey in regards to the NEETs, the children who are not in education, employment or training, and staff are providing more detail on those statistics, which will feed back into the transition review. We will get an update on special needs and disabilities about more quantitative data that was required and the complaints that are going down. In addition, I've queried how the council is engaging with young people and promoting what is readily available.
Okay, thank you very much. Thank you for that update. Councillor Forster, the Environment and Communities panel, is there anything you'd like to update on this evening?
I think it's pretty straightforward. We did a very good short and sharp review of the local transport plan 4 and using the views and material provided by Neil Matthews and also Cabinet member Guy Gilby. We've produced some recommendations and report, and we're in the process of starting to look at the next review, which will be in starting in Jan 25, which will look at social housing in the borough. We're in the process of just starting to pull together the scope parameters, and off the back of that, we'll, as a panel, confirm the scope in December to look to start in January.
Thank you. Wish you all luck with that. So that now completes the updates from the panels, and it also completes our... Sorry, Councillor Webb does have an update from, on behalf of Caroline Eggleston, is this? Apologies, Councillor Webb, I didn't realise you were providing this. So this is the health and care panel update.
Yes, so we've had various health activities taking place in the borough during the last month, and the next health and wellbeing board meeting will take place on the 28th of November. And the hospital rebuilding programme, the government has recently confirmed that 46 hospitals building new programmes will still go ahead, and this includes Frimley Park Hospital. And the next meeting of the JHOSC is on the 22nd of November. Caroline has distributed the minutes, and there's a video of the last meeting that she's put online for everyone to read. We are awaiting our next project, which will be mental health and adult social care, but we're just waiting to start that in due process. Thank you.
Thank you very much, Councillor Webb, and that does now complete the work programme updates and the agenda for this evening. So thank you everybody for attending, your contributions. I now declare the meeting closed.
Thank you. Good evening, everyone. Bye-bye.
Thank you, Chair.
Good evening,
Cheers,
Chair.
team.
Thank you so much. Thank you.